Welcome, everybody. Thank you for joining us for today's webinar, Denials, an Ounce of Prevention. My name is Scott Everett. I'm the Vice President of Analytics Solutions here at PDS. I'm joined here today by Becky Cook, an executive consultant who works with PDS quite frequently.
Thanks, Scott, for the invitation.
One of the things that you know when you are working with healthcare data is that you're trying to manage change. And in order to manage change, you have to get people information. And a lot of the visualization tools that are in the industry these days really can help provide a lot of information to a broad spectrum of end users. So what we want to do today is really dig in and talk a little bit about how we can utilize these analytical capabilities, particularly around the topic of denial.
Scott, today we're going to talk a little bit about the impact that denials have on revenue, work processes, and primarily how to use data to prevent denials. As you know, an ounce of prevention is always better than trying to fix things after the fact. So that's what we're going to start with today. One of the first things that we need to do is understand the impact of denials. We had 3 different studies that we could find that provided us some denial statistics. The first is from the AMA, where they divided denials by payer. You can see that Medicare is the #1 payer in terms of volume of denials. And if you look at the 5% Medicare denials and add them to the rates from the commercial insurers, you can see that they're in the 10 to 12% range for denials. The American Academy of Family Practitioners uses an estimate of 5% to 10%. And the General Accounting Office, which did a study of denials because of the cost that the government payers are incurring to reprocess all the denials, came up with 25% of claims that were being denied having to be appealed. So a lot of the variation is due to the fact that there are really no standards for what is a denial or how to count it, and also that all of the reporting is done in voluntary surveys or voluntary reporting. So it's hard to get effective data. Looking at the cost of those denials, most of you are familiar that it costs somewhere around $21 to file an original claim for a primary care or physician office visit. A very simple claim runs around $20. If we look at the cost of having to reprocess one of those claims for a denial to try and get it paid, the cost estimates range from $24 to $35, depending on the work that has to be done. Those of you working with surgical practices or medical specialty practices know that those costs can be considerably higher than that. When you apply that to a denial claim rate of 5 to 20%, you can see what the concern is with the amount of cost that's incurred every time you get a claim denial. One of the statistics that is easy to believe, but we need to work on, is that we still have only about 35% of denials that get appealed. So there's a lot of revenue opportunity out here for practices.
It's really interesting when you look at that 35%, but it's also pretty easy to understand, Becky, because a lot of times it is so expensive to reprocess these denials that at the end of the day, between all of your time and effort, a lot of times it becomes more expensive to actually reprocess those claims than it is for what you're going to recover from that reprocessing. And the reason why it's expensive to resolve these denials is pretty easy to understand, that a lot of times you have these one-to-many relationships you're working with. You have lots of different denial reasons that you have to overcome in order to get that claim paid. You have to sort out your true denials from partial payments that come across as hidden denials. A lot of times it's just really difficult to get appropriate data that comes across, and that's what makes things really difficult to do. Now, when we talk about denials, particularly in the area of prevention, we really need to understand that we've got to get information into the hands of people because we've got to make change. And in order to make change, you have to really provide some compelling evidence because nobody likes to do it. So if you look at a report like this, you can really go in and help stratify and understand your denials a little bit better. You can see what are the sources of our denials, what's controllable by us. We can then go in and say, here's the impact that denials are having on our organization. So you can see that a lot of the claims that are out there are outstanding denials that have had no transactions posted against them. You can look at the time it takes to collect denied charges and see the impact it has on your cash flow. And what's really compelling is when people understand how your overall reimbursement rates for denied claims compared to clean claims. You can factor in rework costs, all of those things. You put this in front of people, this is what helps to really drive change in the organization. So, Becky, with all of this here, now we know we need to make change because denials are hurting us. Where do we begin?
So I always begin with what information do we quickly have at hand, and how can we report it to our managers and to the people working with claims. And we really start with how much is being denied, what's the volume of claims, which payers are denying those volumes, what's our denied charges trend, and has that pattern changed? I'm looking for outliers, I'm looking for unusual patterns or trend changes. Let's look at a visualization, a little more complex visualization of data for denials. I see that at the bottom we have the denial rate trend, and that data looks like it's getting better. And I can see that we've got a couple departments there that really have really high rates. The trend line up above, it looks like it's okay. We're hitting our target, we're below our target, and our trend line looks good. But one of the things about using analytics is the ability to dig down into this data. So what information do you see here, Scott, when you start digging through it?
Well, Becky, I think it's interesting that you note that denial charges trend up at the top, because you can see that, yeah, it's great. We were able to add some benchmarks. We're able to trend over time. We're able to look at where we were a month ago. We're able to look at where we were a year ago. But we're also able to include a target that may be an external benchmark, or it may be just something we developed internally for where we want to go. And again, right now, as you look at the organization, it looks like we're hitting the target. However, like you said below, when we're looking by department, you can see there are some really high departments that are outliers. When we dig in and really drill down to those outliers, you can see all of those are well above the target that we have. So this is great information to get into the hands of people, because now we know where to focus our efforts. Now we know what we can do in particular, where we need to start, just by applying a little bit of benchmarking and just by really digging in to drive down and see really what's going on within that. So once we know what's there, and once we have this information that we can see where we can start, the step one that we have for preventing denials, we really like to look at three kind of key indicators that are out there in preventing denials. The first thing that we want to look at is, what is it that we can control? If you really dig down into your denial reasons, the bad news is a lot of them are our fault. The good news is a lot of them are our fault, which means they're correctable. We can go in and we can put processes in place in order to make things better, whether it's registration efforts, whether it's coding efforts. These are things that we can go in and fix. The other things we want to look at is we want to look at the overall volumes. We want to understand, is this outside of the norm? And is it just an isolated spike that happened one time, or is it a systemic problem that we need to fix? Both of them have a little bit different strategies in there, but we really want to understand this a little bit better. And then the third thing we usually like to look at is what's being recovered. As we're prioritizing and looking at things, obviously the controllable aspect and the volume aspect are our highest concerns, but when we're trying to decide what's next, we probably want to really prevent the things that we're not able to recover on the back end. So we'd rather try to prevent them on the front end. So with that, let's look at another visualization so that we can help understand better where we can start. One of the things that you see here is the resolutions that we're getting, where we can see what's been paid and what's been adjusted off, and how that can really impact both our cash flow and help us understand our recovery rates. Again, we can see the likely source that's over on the side, and right away you can see registration denials, which is a high impact controllable denial, is our highest denial type. When we filter on that, you can see right away there is one department or one division or one specialty that is causing the bulk of these denials. This gives us information that we need to go in and really focus our efforts, because this spike really means something, and there may be a high return with just a little bit of work from that one department.
So, Scott, I'm looking at the unresolved denied charges in the lower left-hand corner. And to me, I look at that and I say, oh, if we don't get those resolved, that's bad debt. And I can see that the trend is getting better, but we still have a lot of old charges out there that we haven't collected. And then I look up above and I look at the payers and payments that we've received after denials. And while there's some good news out on the right-hand side where we've gotten quite a bit of payment, there is a whole cluster of dots and a lot of charges out there that have no recoveries on them or small recoveries on them. So this tells me how much work I need to get accomplished yet and can help me plan with my staff to work on these.
We spoke before about how we can go in and determine what's controllable by our organization, because that's always the best place to start. Some of the ways that you can look at that are what we've found as we've been working with clients in denials. The things that we can control are our processes. Obviously, registration and authorization is something that we have a lot of control over. It's training issues. We can get in and pinpoint where our problem areas are. We can control the quality of the information that's being input in our charge entry process or our payment posting process. And then we can provide education for our teams regarding required documentation and things like that that will prevent these annoying denials that, while usually highly recoverable, cost a lot in order to get those recoveries. The low impact denials are the ones that really aren't inside our control, are things like medical necessity issues or payer policies for non-covered services. These are really just education issues. You can tell them we're not going to get paid for this. There's not a lot that we can do to control it later on. Also understanding patient responsibility with patients who won't respond or get us information that we need from them. So really, we want to focus our efforts where we can and where we can actually make a difference. So, Becky, what's the first thing that typically is done when we work that way?
So the next thing that I do is really try to focus on what needs to change. I use my analytics to find the outliers, to find the trends. Just as we've showed in some of the visualizations, if there's a particular department, I know exactly where to go and to start looking at what are the people doing there that's causing all these denials? Do we need people change? Do we need process change? Do we need education, communication? And many times it's a process of getting information to the people so that they understand the impact of their work. We want to make sure that we are exerting the least effort to stop those denials, and that we're spending the least amount of money to correct the denials and resubmit charges. So a lot of this step is convincing people of the need for change and providing them the why we need to change and continue to reinforce that information.
So if we look at a different visualization, I think the key in this step is, again, to communicate out to the key personnel or the key stakeholders who are working on this, because denials is really part of our overall revenue integrity process that's out there. And as we've gone in and looked at the analytics and looked at the data to understand where our problem areas are, we need to communicate out what we're doing about it. So it may be something like inserting a coding audit and communicating out those results. It may be that we found some common charge entry or posting errors which require some claims edits that were built on the front ends to prevent these denials. Any of these things can be out there, and we want people to understand what we're doing and what's going on so that they can continue to manage as we go forward. We also want to communicate out things like unintended consequences. So things like, are our processes creating a lot of unnecessary credit balances? Are they driving up our first insurance payment lags because we're spending a little bit more time on the front end? And is that comparable to what we'd be getting on the denial lags on the back end? So really, it's a communication effort at this time. We're just trying to make sure that everything that we're doing is as quality as possible. So once we've got those in place and are communicating out, what are we doing next?
Trying to sustain that change. You know, it's human nature that when we have to implement a change, we tend to lapse back into our old behaviors or the old way that we used to do things. So we want to make sure that we are reporting to both the people doing the work as well as the stakeholders why it's so important to maintain those changes and to keep improving the processes. We want to make sure that we've communicated many times what the change is and also develop contingency plans on what if something doesn't work the way we wanted it to. Who's going to monitor those changes and how are we going to report out on those to our users and to our administrators? And how are we going to report progress against those expectations? You can see below just a little quick answers, which is a visualization, very simple, that just says, are we hitting the targets that we've set? And you can see instantly that we're hitting 4 of the 5, and we have an 80% compliance rate. That's about as simple a dashboard as you can get. But let's look at the entire dashboard that we've put together. We call it a quick answers dashboard. And what you can see here is that we have a different set of questions because we're looking at different data on this second page of a multi-page dashboard. The chart that I like to zero in on is that resolution to date, because I want to see, in fact, how have we recovered, what have we recovered, why have we recovered it. But I also want to look at the cumulative days to collect our denied charges, and we want to look at our denied charge trend. The other one is, again, that denied charges trend with 0 payments on it. I look at those balances in accounts receivable and I keep thinking, this is potential bad debt. This is potential revenue that's lost. And so I can see from this dashboard what we're doing, but also what our effort is still available, what results we can still get from working those denials.
So if we go into another visualization that's out there, again, I really want to emphasize the power of the tools that are available in the market today, because analytics has become such a key process with really any organization. And it allows us to put lots of different information into the appropriate hands where they go. So we can create a visualization like you saw, but we can also create very targeted ones to send to a revenue cycle team or a front-end staff that's targeted just to registration type information. You know, what we're looking at here would be probably more of a senior management type thing to look at the overall effectiveness of our prevention efforts. And obviously we don't have a lot of data on denials that aren't happening, so we still have to track what is happening. But in this case, my eye is immediately drawn to the denial by likely source in the center right. And what you can see right there is that most of the denials that have come across are sourced by either the payer or the patient, which means we're doing our job and we're controlling what we can. If we look at the denied charges by payer or by department, you can still see we have some outliers. There's still some work to do on our end. However, now that we know we're able to control what we can control, it's going to allow us to put some better strategies in place to go after what's left over out there. What are you looking at here, Becky?
Well, Scott, the information that I'm seeing here is just phenomenal compared to the days when we used to have to sit and work denials one by one from paper. We just never knew where we were with denials, what was out under appeal, and what we were recovering. So I think the thing that really catches my eye is the ability now to take those denials and to represent them not in charges, but at the allowed amount, so that we can start to gauge what is our ability to recover funds based on what's going to be allowed for those charges. It gets rid of all the guesswork of going after the wrong charges only to discover that we're only going to have a collection rate of 5% on those charges. What you can see highlighted on the left-hand side of that middle graph, denied claims, the profile amount with the recovery rate, is that there's a large brown dot at the top. So that is a lot of allowed charges, the claims at the allowed amount for which we have not collected anything yet. That is our number one potential, and it happens to be an E&M code 99244, where we have $650,000 of opportunity. So that would be my number one target. Also of interest is those that we have collected, which is on the right-hand side. There's another brown dot on the tail end at the right, and those are charges in which we have recovered the funds, and the recovery rate is actually pretty good on them. It's just that there weren't a lot of charges out there and the allowed amounts were not significant. So if we've put all of our efforts into collecting those claims, it really hasn't paid off for us very much. You can also see that as we click on the different buttons, you can see those denial likely sources. And where the denial likely sources is from the patient or from the payer, the recovery rates are lower. So tremendous amount of information here that lets me monitor what are we doing and are we applying our denial team resources correctly.
Thanks, Becky. So I would say, to sum up with what we've talked about today, obviously denials is a huge problem and they're really expensive to resolve. And so as we move forward, prevention is really going to be the key. And in order to prevent, we've got to see where we are to begin with. So we need to really analyze our work processes and what is it that we can control, what's our fault, and then work to correct those. We need to make sure that we've got strong analytics in place to report on denials that are happening, denials that continue to happen. We need to be able to communicate that out to key stakeholders at the very beginning, let them know where our focus needs to be while the process is going on, communicating out what we're doing, and then at the end, communicating out, were we effective? Did we do the right things? And if not, we need to rethink our strategies and move forward.
Scott, the advisory board actually published a statistic that says that they believe that 90% of denials are preventable. That would go a long way to eliminating a lot of the wasteful costs in managing a practice or managing a hospital, is to get rid of all of the paperwork that has to be redone or the electronic files that have to be massaged. So that's our real opportunity, besides collecting the denials that are in our current pot, is getting those prevention processes in place. And being able to use robust analytics to identify and communicate what we're doing and what needs to be done is just a tremendous improvement that has come about in the last couple of years with the new technology that's available.
I just want to thank you all for joining us today. If any questions pop up later on, please feel free to contact us at learnmore@pds-online.com or support123@pds-online.com, and we would be happy to discuss how we can help you be successful in your organization. So thank you very much for your time today.